Okay, Shalom. Shalom. Kwam Yasha'Allah, Koholim La Yahweh Bashim Yahushai, Bahashem, Rakah HaKodash, double honors to our apostles and elders of Great Millstone who rule well, and that by the Spirit taught us this beautiful truth. Just want to say the water to all the H.I.M and Akwaf that's out here sincerely keeping the laws, the statutes, and commandments of Yahweh Bashim Yahushai to the best of their ability. This is Yachanan Nawach. Just coming at you with another quick lesson, praying that it's edifying by the Spirit. And this is in USA Today. Bad FLU season. You know that particular. You know what I'm saying. FLU season getting worse. Skyrocketing cases. Set state record, right? So it was. I done a lesson on this like 2 weeks or so ago. It was supposedly situated and concentrated more in like two states. I think it was South Carolina or maybe North Carolina, and it was another state as well. But now they're saying that it has, moved so-called across all the states, basically. Okay, so it says the FLU is surging across the United States amid a busy holiday travel time. They always say that, I guess if there's going to be some, and this is not medical advice, if there's going to be some passing of fluids and passing of people being in boxes, as far as planes, they on buses, they on trains, they on and they're concentrated in all these places and they're breathing on each other. Certain things can't happen. I can see that being an incubation center, you know what I'm saying, for certain things. Because the Lord, He did create these plagues and diseases, so to speak. But it says the state of New York is among those most heavily hit. Now you of course, but see you do have to realize. Now let me get this quick scripture real quick because we're not ignorant of Satan's devices, right? Because Esau, he know that these are congested cities, and if somebody were to say that, then of course it's believable, even though it may not be. It could be true, it may not be true. We're not saying that it's not true. Like I said again, this is not medical advice, but you have to keep in mind who you're dealing with. You're dealing with the wicked that the Bible speaks of. You're dealing with the Job 9:24. The earth is given into the hand of the wicked. He covered the faces of the judges thereof. Is not wearing who is he? Because he's running the earth. He's able to say what a disease is and when it comes about and how long it lasts and the numbers of just the numbers, who passed away, who got. He's the one in control of the data. No one can question it because supposedly you're not a scientist, you're not a doctor, you're not. All you have to, only thing you're supposed to do is listen to what they say, and you're supposed to believe it. And that's the reason why they're coming up with a lot of these. It's basically about to become famine of the word, or they have these laws now where certain things you can say and can't say. See, they started that with COV 19. Everybody was saying what they were saying. You had doctors, experts actually, that was saying what they were saying, and they were being deleted. They were being fired. A lot of channels got deleted off YouTube, things of that nature. You got strikes, and you couldn't speak on the subject. So it is what it is, man. This is 2 Corinthians 2:11. Lest Satan should get an advantage of us, for we are not ignorant of his devices. So let's go into this article because it's very interesting in some of the stuff that they're saying here. Which we've been going into it anyway. The flock. We're warning the flock, man. We're on the watchtowers. But it says the state of New York is amongst the most heavily hit for the week ending December 20th. The state reported its highest number of positive FLU cases, 71,123, ever recorded in a single week, according to the New York State Department of Health. That represented an increase of 38% over the previous week. So that shit is like damn near 50%. New York is one of the 14 states that reported high or very high activity of outpatient visits to healthcare providers for influenza like illnesses for the week ending December 13th, according to the Centers for Disease Control, that's the CDC. The District of Columbia New York City, and Puerto Rico have also registered high and very high FLU like cases, the agency says. As of December 16th, FLU infections were on the rise or likely growing in 47 states. So now it's pretty much all of America, with cases only declining in Hawaii, the CDC projected. So, again, we got to be careful with the language. The increase in seasonal FLU activity across the United States is similar to several past seasons, the CDC says, but it comes along with a new FLU strain. They when they say that, there's like something. Oh, this shit done overrode the old. It's not what it used to be. This shit done re-upped. It's done took some steroids. This shit is in the gym. This is Esau, man. His wording. It says subclade K. I don't know how they come up with these names. Subclad or subclade K, a variation of the influenza AH3N2 virus, responsible for FLU outbreaks in Japan, the United Kingdoms, and Canada. Help see this see how it's regional or is pretty much throughout the world, so to speak. So it's nothing for them to do another COVID-19, do a lockdown, whatever, because we're not ignorant of Satan's devices. We're not ignorant of his schemes. Health officials have been concerned the current FLU vax, rolling up your sleeve, taking that jump shot, if you know what I'm saying, have been concerned the current FLU, hold on, Slakia, it may be a mismatch to the new variant, but they are confident it has protections against serious illness. Health officials aren't yet sure if the new FLU strain is leading to more infections or more severe cases, but what is clear is that cases are increasing, and we're seeing a lot of influenza cases increasing across the country. And that's a trend that we are sure will continue in the new year, said Andrew Picos, the co-director of Johns Hopkins Center of Excellence and influenza research. December video. You got a December 16th video, a briefing, which I could have went into that, but it's a lot. We'll just read on. Also, potentially contributing to, they're going to go into this. It's actually, that bullet point is fewer Americans getting the FLU shots this season. Also, potential contributing to an increase in the FLU, a decline in Americans getting the FLU shots. While more than 47.6 million FLU jump shots have been given at retail pharmacies and physician medical offices so far in 2025-2026, that's a lot of fucking people. That's down about 3 million FLU shots from last season. So they're like, hey, they missing money. Can you imagine 3 million people not generally getting the shot when they normally would? At what cost? I'm not even sure what the cost is for that actual, but that's a lot of money. That shit is in the billions. That's a lot of money being lost. The government shutdown, which ran from October 1st to November 12th, also likely meant a decrease in the FLU activity data, which could have affected the shot rates, said Jennifer Nuzzo, professor of epidemiology and director of Pandemic Center at Brown University School of Public Health, in a FLU report published in December 19th, Journal of American Medical Association. Again, this is not medical information, just reading an article. We're potentially heading into the FLU season. That could be quite a doozy. And we know we're starting it with fewer data and more crucial, fewer shots, she said. So it says that the FLU has led to 1,900 deaths so far. And this is their numbers, man. The CDC estimates that there have been at least 4.6 million illnesses, 49,000 hospitalizations, and 1,900 deaths from the FLU so far this season. During the week during December 13th, there were 2 pediatric deaths reported to the CDC, bringing the FLU related pediatric deaths so far this season to 3. So I'm assuming 3 babies died. In Colorado, where the CDC said FLU like activity was very high, emergency department visits with FLU diagnosis increased 7% for the week, including December 20th, according to Colorado Department of Public Health and Environment. Influenza accounted for 7% of emergency department visits in Louisiana, up from about 6% the previous week. According to the Louisiana Department of Health, all respiratory illnesses, including FLU, COVID-19, and RSV, made up nearly 9% of emergency visits, the department said. So now you got all 3 of these particular, plague, so to speak, moving, right? You see what I'm saying? You see what it says? Including the FLU, COVID-19, and RSV. You got to put it together if you're new to this, because we're reading in code, so to speak. In New York City, visits to the hospital emergency rooms with a flu diagnosis increased to 8.75% for the week ending in December 20th, up from 6.76% the previous week, according to the New York City Department of Health and Mental Hygiene. These states have high and very high FLU activity. The CDC FLU View interactive map is based on outpatient visit to healthcare providers for influenza-like illnesses within a state or territory. These states and territories had high or very high levels. So you got Colorado, it says very high, Connecticut high, District of Columbia high, Georgia high, Idaho high, Louisiana very high, Maryland high, Massachusetts high, Michigan high, New Hampshire high, New Jersey high, New Mexico high, New York very high, North Carolina high, Puerto Rico high, and South Carolina high. So these are a lot of your major cities. Where are the latest FLU symptoms? Symptoms associated with H3N2 are similar to those of other influenza viruses and include fever, cough, runny nose, fatigue, muscle ache, and chills. Okay? It's not too late to get the FLU shot. The CDC, World Health Organization, and other leading medical institutions consider it the most effective way to prevent serious illness from the FLU. You know those organizations. You got the CDC and the WHO. Everyone 6 months or older is eligible for the FLU shot unless they have a specific medical condition, such as an allergy to the ingredients or a previous severe reaction to the shot. Okay, so yeah, you know what it is. To help stop the spread of influenza, wash your hands often with soap and water for at least 20 seconds. Well, that's the same thing they said with COVID-19. Or use an alcohol-based hand sanitizer. Notes the New York State Health Department. Other tips to prevent the spread of the FLU include avoid touching your eyes, nose, and mouth with unwashed hands. Stay home if you're sick. Avoid close contact with people who are. Cover your cough or sneeze with tissues and then throw the tissue in the trash. Clean and disinfect frequently touch objects and surfaces. Yeah, the same old thing that's been going on for years with that. But okay, so that was pretty much it on it. I just wanted to kind of touch on it because you know what could actually go down from here if they really wanted to go down. 2 Corinthians 2:11 again, lest Satan should get an advantage of us, for we are not ignorant of his devices, man. So you know how they get down. They'll run down the game on you, and next thing you know, it's another lockdown system, so to speak. And see, for us, because you got Israelites that's saying that, you had Israelites that endorsed, matter of fact, pushed hard that you go and take that, roll your sleeve up and take that last shot. And you know what the last shot was. And a lot of people, ended up they're not here today. I'll put it that way. They're not here no more. They didn't show up for work today. I'll put it that way. They went back to the upper room. But let's get this real quick. Ecclesiasticus, also known as the Book of Sirach in the 1611 King James Bible, never trust thine enemy, for like his iron rusteth, so is his wickedness. Though he humble himself and go crouching, yet take good heed and beware of him, and thou shalt be unto him as if thou hast wiped a looking glass, and thou shalt know that his rust have not been altogether wiped away. See, they talking about 3 million people. They down 3 million people. That's a lot of money, because I'm not sure how much that insurance wise, if you're using your insurance, but just cost. If you missing 3 million people, let's just say that the jump shot is $20 a piece. $20 times 3 million people, that's a lot of money. Even if it's $10, even if it's one damn dollar, that's $3 more million. You know what I'm saying? I mean, but these people deal in the billions. So but the Lord gave us a commandment to not trust. Hey, it's plenty of and again, this is not medical advice, man, because why don't these doctors tell you about certain foods or vegetables or fruits or anything that you're supposed to, your diet once you get home from even taking this thing, even if that's what you've done. Why don't they tell you that? Why don't they tell you, okay, well, why don't you do this? You do this, and this will help, right? But they don't do any of that. They just basically like, oh well, yeah, come on in, roll your sleeve up, come on back and take that, a Boost Mobile, come on back and take another Boost Mobile, and you're gonna be fine. And people we see what it is. I'm not gonna go too far into it. You know what it is. We have to be a little alert about how we say these things. But hey, just be on point. Pray first off. You should be praying to Yahweh about Shema Shah for healing. Let the elders or the brothers around you anoint you. Anoint yourself. You can pray over some oils. Anoint yourself. Pray to Yahweh about Shema Shah, mainly for your healing, man. Because Esau, they don't believe in that. They like that's misinfo. If you telling a person to pray, like but they get on TV and tell you to pray for somebody that's done died in the government or some soldier or some shit. But when it comes to praying over your health, nah. It don't mean, don't do that. But anyway, with that, I pray that this lesson was edifying. With that, Kwame Allah and a Bible Ball.